Assalamu alaikum wa rahmatullahi wa barakatuh. Today I will talk about pain management. This lecture is pharmacotherapy oriented and focused. So let's start. Bismillah. I will talk about definition, classification, pathway, measurement of pain, management, and I will mention about pain management teams in Saudi Arabia, inshallah. So, what is pain? Pain is unpleasant sensory, emotional, and cognitive experience. It is provoked by real or perceived tissue damage. We say perceived tissue damage because sometimes the tissue damage is not real. For example, in phantom limb pain يعني اللمب المبتور يشعر patient actual real pain in the imputed limb. So it is a perceived tissue damage. Classification of pain. There are three types of pain. There is the nociceptive, the neuropathic, and the inflammatory. Oftentimes they occur simultaneously, they occur together. So the first type is the nociceptive pain. It is the pain that we all feel and experience. However, the neuropathic pain is a damage to the nerves themselves, and this pain is severe and it feels like a burning sensation to the patient. Examples include the diabetic neuropathy and spinal cord injury pain. Inflammatory pain is due to inflammation. Examples of diseases that cause inflammatory pain are appendicitis, rheumatoid arthritis, inflammatory bowel disease, and herpes zoster. So, as we took in pharmacy school, pain intensity can range from 0 to 10, and usually we categorize the first 4 as mild pain, 5 and 6 are moderate, 7, 8, 9, and 10 are severe pain. The pain duration, as we all know, acute and chronic. What do we mean by acute? It is from 3 to 6 months. And what do we mean by chronic? It is more than 6 months. The pathway of pain signals start with the transduction or the sensation, and then the transmission is the movement along the neurons or the nerves. Perception is the interpretation in the brain. Modulation is inhibiting the pain. So perceptions happen at 3 sites: the reticular system, somatosensory cortex, and the limbic system. Reticular system, as shown here in the picture. This is the reticular system in the brain. So, when the impulse arrives at the reticular system will do its job, which is autonomic and motor response. Autonomic, such as involuntary responses, such as pulling the hand away or raising the heart beats. Somatosensory cortex job is to identify the intensity, the type, the location of the pain, and it also relates it to past experiences. The limbic system is responsible for emotional and behavioral response to pain, so it regulates attention, it regulates mood and motivation in the brain. So next time you feel like you're not motivated to do something relatively painful, such as maybe working out, you can blame the limbic system. However, modulation is the good side of the pain pathway. Such examples of modulation is the release of endorphins, especially after a workout, the release of serotonin, and the release of oxytocin, which is after labor. Management of pain according to its intensity. We have the mild, we treat it with non-opioids. Such examples include non-steroidal anti-inflammatory drugs, acetaminophen, and with or without an adjuvant. An adjuvant is a treatment or an intervention for the main use is not analgesic, such as antidepressants or anticonvulsants, but we use it as an adjuvant to help in therapy. Adjuvants also include hot pads or cold pads. It also includes exercise. It includes psychological support. For moderate pain, however, we use weak opioids, with or without an non-opioids, or with or without an adjuvant. For weak opioids, such as codeine, such as also tramadol, dihydrocodeine, etc. These are the weak opioids. Pentazocine is a weak opioid as well. Dihydrocodeine. For severe pain, we use a strong opioids. Strong opioids such as morphine, fentanyl, pethidine, oxycodone, hydromorphone, and with or without a non-opioids and with or without an adjuvant. Okay, now I want to talk about the spinal cord stimulators. These stimulators are wires that are placed between the spinal cord and the vertebrae. These wires are connected to a generator. This is the battery for the electrodes. So the electrodes, two electrodes, two wires, as shown here in the picture. As you can see, this wire in the green color. Let me zoom for this. Okay, as you can see here, the green color is between the vertebrae and the spinal cord. As you can see, it is connected to the battery. The technology allows the patient to press the button whenever he feels a pain. So what happens when he presses the button? The wires have electrical signals in them, and this electrical signal or electrical impulse will interfere with the pain signal pathway. So it inhibits the connection of pain signals to the brain. The next one is a morphine pump. This morphine pump is connected to the spinal fluid, and it produces morphine throughout the day, so the patient doesn't have to take a morphine or to inject morphine intravenously. He just sits there and the morphine delivers automatically. Last intervention I want to talk about is ketamine infusion. So after the patient or the chronically ill patient tries all of the interventions, so he tries the non-opioids, he tries the opioids, and they are not effective. He does some surgery with the two interventions or others. Also, there are other interventions as well for pain, and they are not effective. So what he do? He might go for ketamine infusion. So ketamine is an anesthetic. It's for use of anesthesia, maintaining and producing. It is a non-competitive N-methyl D-aspartate antagonist, but it is used for psychiatric disorders such as depression, and it's also used for chronic pain management as well. So there is weak evidence for spinal cord injury pain for the use of ketamine with spinal cord injury pains. But if the physician decides that it is the intervention that he's gonna use, the guideline includes 0.42 milligrams per kg to 0.4 milligrams per kg, ranging from 17 minutes to 5 hours for a whole week or 7 days. And it should be noted that for spinal injury use of ketamine, there is short-term improvement regarding pain. For complex regional pain syndrome or CRPS, there is moderate evidence supporting the use of ketamine infusion for relieving of pain. The guideline for CRPS is 22 milligrams per hour for 4 days or 0.35 milligrams per kg per hour over 4 hours daily for 8 days. So this is for 10 days, and this is 7 days for the spinal cord injury. However, for the complex regional pain syndrome use of ketamine, the improvement is for 12 weeks. For 12 weeks, or that may include 3 months. So ketamine side effects. Euphoria. They include euphoria. That's why ketamine is an abusive drug. Hallucinations. So that's why we don't use ketamine with patients who have poor controlled mania, who have poor controlled psychosis, such as bipolar disorder. And they also cause dissociation, so you feel you're not connected to your body. Immobility, unable to move, slow breathing, difficulty speaking. I have seen patients who receive ketamine infusion and their speaking is very heavy. زي ما بنقول يعني لسانهم كان ثقيل بالكلام. Psychosis, يتخيل يعني أفكار غريبة. Also hallucinations, يشوفوا أشياء غريبة. Increase or decrease in the heart rate, also increase or decrease in the blood pressure. So from the side effects, we can conclude that ketamine is not used with poorly controlled cardiovascular disease patients, with patients who have high blood pressure, patients who have arrhythmia, also patients who have bipolar disease, as well as hepatic dysfunction. But if the hepatic dysfunction is light and it is not severe, the use of ketamine infusion can be implemented with the proper monitoring in moderate disease hepatic dysfunction patients. There is also a ketamine spray, nasal spray, for breakthrough pain, and this spray is a systematic drug. However, in pain management teams in Saudi Arabia, they are distributed. There is a team in King Fahad Specialty Hospital, King Fahad Medical, King Fahad Medical City, and also in King Fahad University Hospital. There is also a pain management team in Aramco Hospital. That was my presentation in pain management. If you have any questions or any queries, I would love to see them in the comments. Feel free to ask me anything you want, and thank you for presenting and being here with me. Goodbye.